Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. I wanted to begin with an update in Region 7. We've seen a bit of an increase in numbers there.
Well, actually, I think Region 7, the numbers are coming down a bit. We still have an issue with Waramadong, where we still have a number of cases in that community. But as you know, we have started, we have a team there. We have a resident doctor, and we have been providing additional support. So my anticipation is that in another couple of days, we should start seeing a decline in the cases that we have there.
I wanted to follow up with Region 8. We know that 2 COVID-19 checkpoints were to be set up. Do you have any word as to whether they have been set up or not?
No, it was something that was under consideration by the task force, but after closer examination, the task force decided not to proceed with that. So, but there are other ways of monitoring and evaluating what's happening in Region 8, and I think that has been working quite well.
I wanted to touch on the budget again, the $900 million that was set aside for HIV, related treatment and testing and so on. So what are some of the immediate programs that the ministry will be working on? And I wanted you to expand specifically on the HIV self-testing.
So with HIV, we have made a commitment that we want to achieve 90-90-90 by 2020. That is, persons who are at risk for HIV, 90% of them would be tested, and those who have been tested, that 90% of those would have been treated, and of those who have been treated, that 90% of them would be virally suppressed. Unfortunately, the country did not achieve all three 90s, and there might be varying reasons for that. We did, however, achieve the first one in terms of getting people tested. So there's still a lot of work to be done, and we want to accelerate this process of getting more people on treatment and then to get more people virally suppressed. So with that in mind, the allocations that we have received, a lot of that would go in the direction of providing adequate amount of ARVs and to make sure that the patients are receiving these ARVs. So that would be a main thrust for us. In addition to that, we have paid a lot of attention to how to reduce risk or to increase prevention types of activities. And one of the prevention methods that really work is pre-exposure prophylaxis. And that is if you provide persons with medication who are at risk for HIV, and if they've been consistently taking the medication based on the guidelines, then they would not be able to contract HIV. We have implemented, when I said we, the previous government had started a program, but that program was for persons in a serodiscordant relationship, meaning that if one of the partner was positive and the other one was not, then they provided pre-exposure prophylaxis for the partner who was not positive. We want to extend that so that anyone who feel that they're at risk would be able to come into one of our clinics and receive the pre-exposure prophylaxis medication. And so that's something that has been recommended by PAHO, WHO, UNAIDS, and many of the other international bodies that have been working on HIV, because they see this as one of the most effective ways in reducing HIV transmission. And we therefore, starting from this year, we would be extending our pre-exposure prophylaxis program to cover anyone who is at risk. So that's something that is going to be new. In addition to that, another thing that we are introducing, which would be new, is self-testing. Traditionally, when someone wanted to get an HIV test, they would have to come into one of our clinics, go through a process of being screened and counseled, and then the test is taken, and after you get back the test result, you're counseled again and then given your test results. I think there's a little bit of fear that if you can access a kit on your own and you can test yourself, that people are fearful that this wouldn't work as envisaged. You know, maybe people would be a little bit scared, or psychologically they might be traumatized and so forth. But the research and findings from other countries where this has been implemented has not shown that any of these fear or things that people might envisage would happen has happened. And in fact, it allows people in the privacy of their own home to be able to do these tests, to check their status, and once they know, then they probably would come into the clinic and get it verified, and further actions can be taken. We have started a process of planning for this, and right now the National AIDS Program Secretariat, along with other stakeholders, have developed a strategy in terms of self-testing. So after the budget, our plan is to roll out this particular strategy, and to be able to procure those test kits and make them available to the persons who are interested in getting them. And same for pre-exposure prophylaxis. After the budget, we'll be able to start rolling this program out. And all of this is consistent with the new strategic plan that we have put in place for HIV, because as you know, early in the year, we launched a new, last year actually, we launched a new program, a new strategy for the next 5 years, so from 2020 to 2025 on HIV. And we are right now completing a similar one for TB. And we have plans of how to manage TB HIV co-infections, and that is reflected in the new TB plan that we have.
Thank you, sir. I wanted to wrap up with an update on the filaria campaign.
So I think with the filaria program, as you know, we have launched on Monday, and it has been going very well, because we have started with the two, with Region 4 and with Region 3. And our expectations, we are going to be spending at least 14 days in these two regions. So far, the response has been really good. We were able, as of yesterday afternoon, to reach at least about 39,000 persons, and that's a relatively good percentage in such a short time. Our teams continue to work, and we would like to urge the population to give them their cooperation, because if we're all successful at this particular program, then in a few months, WHO would be able to certify that we have eliminated filaria from Guyana. So this is a team effort. We are providing the medication, and we want people to take the medication because we want them to be protected. And so we'll urge everyone, when you see the team come around, to talk to them, get educated, and take the medication so that we can all eliminate filaria from Guyana.
All right, thank you, sir. Well, we at DPI were visited yesterday by the team, and I must say that they did an excellent job in explaining why we needed to take it, and also they were very adamant that they had to see you actually take the pills.
Okay, well, that's good.
All right, Minister, thank you so much. All right, well, that's it for today's COVID-19 update. Remember, we, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.